Hi, I'm Peter Saitta, and I'm a board-certified dermatologist. Today, I'm going to speak about acne. Acne affects about 630 million people worldwide. That is a lot of people. Recent studies have shown that 80 to 90% of all teenagers are affected in the United States. Although most people think that the risk decreases with age, new data has shown that 50% of all patients have acne well into their 30s. As you probably already know, acne is not only a skin condition, it has a significant psychological impact, and in many instances can increase the rate of anxiety, depression, low self-esteem, and in some instances, suicidal thoughts and tendencies. For this reason, I treat my acne patients with a multifaceted approach, and many times I use 1, 2, or even 3 different medical approaches at once. In conjunction with the medical approach, sometimes I even do cosmetic treatments, and I find that all of this working together works best. Results are quick and long-lasting, and recurrent outbreaks can be kept at a minimum. A clear complexion is not only possible, it is our expectation.